I'm Tiffany, one of the nurse practitioners at Muskingum Valley Health Center, Adult Primary Care. I also have experience in the urgent care setting as well as the intensive care. I'm here today to talk to you about when it's appropriate to go to the emergency room versus calling your primary care doctor. Deciding whether to go to the emergency room versus your primary care doctor can be confusing at times. The emergency room is designed for pressing concerns which would involve immediate threat to your life if not taken care of promptly. Your primary care provider is available for all other concerns, including those related to chronic disease, illness, or ongoing conditions. Sometimes it can be tricky to decipher whether you should call your primary care provider or go to the emergency room. An example of this would be back pain. Sometimes back pain can be acute or sudden, or chronic, recurring, and ongoing. For chronic, recurring, and ongoing back pain, you should contact your primary care provider so that you can be evaluated and treated properly. For acute and sudden back pain with alarm symptoms such as loss of sensation to the lower extremities or weakness, including incontinence of urine or stool, you should present to the emergency room, as this could be a medical emergency. Allergic reactions, including swelling to the face, tongue, or shortness of breath, chest pain or pressure, which could indicate a heart attack, numbness or weakness in one side of the body, facial drooping, or difficulty speaking, which could indicate a stroke, level of consciousness changes, such as fainting, syncope, lethargy, and difficulty arousing, overdose or accidental poisoning, seizures, bleeding that won't stop, including nosebleeds, or menstrual bleeding that saturates more than 1 pad per hour, large lacerations or lacerations with persistent bleeding, vomiting or coughing up blood, head injuries, headache with fever or worst headache of your life, fever higher than 103, severe abdominal or flank pain, especially in the presence of fever, major burns, and broken bones. Most other conditions should be addressed by your primary care provider. If at any time you have any questions of whether to make a doctor's appointment versus going to the emergency room, you should contact your primary care provider's office for advice. If you're in search of a primary care provider, you can contact MVHC at 740-891-9000 to schedule an appointment today.